Two commonest causes of valve disease are aortic stenosis, which is a narrowing of the aortic valve, and mitral regurgitation, which is leaking of the mitral valve, which is the valve between the heart and the lungs.
The aortic valve is the main valve through which the blood flows from the left ventricle, which is the main chamber of the heart, going to the brain and to the rest of the body. So it's the main gate which allows the blood to flow.
The aortic valve usually has three valve leaflets, and each of those leaflets is very thin, about the thickness of a piece of paper. And what can happen in people, particularly as they get older, is those valve leaflets can thicken up and get full of calcium, such that they become thick, up to maybe 1 centimetre thick. And as they do so, the hole through which the blood pumps can be significantly narrowed. In
Britain, at the age of 65, there is about 2% of the population, so 2 out of 100 will have that disease. And as those patients get older, the degree of the narrowing gets worse.
Aortic stenosis or mitral regurgitation are both very serious diseases which can adversely affect your quality of life and adversely affect your life expectancy. But actually, patients who have those conditions can be treated very effectively by valve replacement therapies. So, by and large, with people who have narrowing of the aortic valve, there's 3 different sorts of valves you could replace them with. The first is a mechanical valve, and the mechanical valves are made of very smooth metal or carbon. The blood flows through them very nicely, and they very rarely wear out over time, but you do have to take blood thinning tablets for the rest of your life when you have those valves in. The second option is what we generally call a tissue valve, which is usually a valve which is made from a native valve of an animal, a pig, or made from the sac that surrounds the heart of a cow, a pericardial valve. And again, those valves have advantages in that you don't need to take the blood thinning tablets and have good life expectancy, but they can wear out over time. The third option is to have a valve which comes from a human cadaver, a homograft, or sometimes you can use a valve from another part of the heart.
The definitive treatment is surgery, but the art is to find the exact time when to operate. And that's a decision made by multiple medical team, including a cardiologist and a cardiac surgeon. So the main treatment is valve replacement. But now we face with older generation who are not fit for operation. They have a lot of other morbidities, like diabetes, high blood pressure, and generally frail bodies. And they cannot go through a major surgery like aortic valve replacement. But recently, we're lucky to have a new approach called TAVI, which stands for Transcatheter Aortic Valve Implantation, which is a non-invasive way of replacing the valve.
This is a technique whereby you can introduce a valve through a small puncture in the groin by passing a wire up around the vascular tree and stretching the narrowed valve up and putting a valve in place. That is a good option for people who are not fit to undergo conventional surgeries.
And TAVI has transformed the management and transformed the life of those patients.